Hi, my name is Kevin Gibbons. I'm here with my colleague Costaritah Nalukwago, and we are going to talk about an organization we really love, Health Access Connect. We'll first talk about what HAC does and what we've done in 2021, and then we'll talk about what we're going to do in 2022 and beyond.
Thank you, Kevin. At Health Access Connect, we link communities to healthcare. How we do this? We do this through the MediCycle model, which embraces community outreaches. For an outreach to happen in the community, we need 2 to 4 health workers. We need medicines and supplies, and these are provided free of charge by the government. However, they're facility-based. So to get the health workers and the free medical supplies to the communities, we need transportation and we need mobilization of the communities. So for these, we need costs to cover them. And what we do at Health Access Connect is mobilize communities to be able to make a wealth pooling that actually covers these costs. That way, this can happen even without additional funding. In 2021, we have been able to do more expansion of the MediCycle model, and we have reached out to many more communities. Like over time, since 2015 when we started, we have seen the growth of number of outreaches. And in 2020, we were affected by the COVID-19 pandemic. There was a lot of not sure what to do. However, it was a time for us to learn. And in 2021, we have made more expansion and reached almost 300 outreach clinics with an increase in number of patient services distributed to almost 40,000. We also have the family planning project that actually looks at couple year protection, which is a measure for family planning coverage. And for this project in 2020, we had a target of 1,680 that by the end of the year, we were able to actually surpass. And then now we received the next funding for another year with an increased target, which by the end of 21, we have been able to also surpass, and we are proud of that.
My colleagues and I have been involved in a technical assistance project under the Ministry of Health in Uganda, and we've been really honored, and it's been a watershed moment for HAC. We've basically taken what we've learned over the past 7 to 8 years and made it into a national pilot, developed it into policy, and worked with the Ugandan government to see how you could see community-led outreaches at a national level, and then teaching, sharing with other organizations how to implement. And for me right now, it's clear how we can take what we've learned over this time and reach 1 million plus people by doing it this way. On top of that, we've been taking our experience developing dashboards, monitoring performance on a regular basis, and sharing that to improve kind of, management and data visualization and all that fun stuff at the national level. And that's really been a great contribution. And we've grown. We're so excited that we're now at about 19 staff members. We have a full monitoring, evaluation, and research department, which is so important for a health nonprofit. And we're really building leadership in the organization, people taking over things. And we sort of are so proud of what of the organization that we've built and all these colleagues that you have pictured here. It's a fun workplace, and we're so proud to be able to, have impact together. So what are we going to do in 2022 and beyond? This is typical what an outreach clinic looks like. What we want to do is to seriously expand Costa's crazy expansion. She sees the way forward, and she's the one who leads that. And we could easily see how we do that, continue to expand in Uganda. And probably also help with distribution of the COVID vaccine, which we've already been a part of, sort of working within government initiatives to that, because we must vaccinate all of Uganda and the world. We're going to start using, we have started using community groups and other changes to outreach. You know, our hope is to really become a center of excellence for serving remote communities and spread this to other countries and other areas. And so continue to pilot and try new things and see what can improve sustainability and work within government policy, which we've been learning a lot about. And then lastly, we're very excited about research collaborations to document our work, be systematic about what are our actual impacts on community health in these remote areas and where we go from there. So we're excited about the year to come. We're excited that you get to join us as well and be a part of that. And you're wondering, what can I do? Thank you for asking. You can donate. And that's at healthaccessconnect.org/donate. Our campaign slogan this year is the Last-est mile. That's not great English, but it is a perfect description of what we do. Most people, when they think of the last mile, it's going to rural health facilities and making sure that people have access to medicines and services. And we go beyond that. We go to the most remote areas, the underserved areas, and work with the people at those facilities to make sure they cover their most difficult to reach patients. So every donation that you give goes towards that mission and then towards that way of operating. And so we hope you'll donate. Thank you so much. We wish you a happy giving season.